Hey everyone and welcome back to my YouTube channel. जनरल मेडिसिन का एग्जाम सर पे है और हिस्ट्री लेना नहीं आता? डोंट वरी, लास्ट मिनट हिस्ट्री टेकिंग डिटेल्स के लिए आप सही जगह आए हैं. If you want to study history taking in detail, I would recommend you to read a good book, for example, Bedside Medicines by Dr. Anup Kumar Kundu. But if you lack time to go through that detailed book, here's the shortcut. So to begin with, you have to take the demographic details of the patient. The demographic details include the following. Firstly, the name of the patient. So the name is important for two specific purposes. First is identification of a patient, and then is the rapport building. So if a doctor calls you by name, there is a personalized touch or a connection that develops between you and the patient. Next comes the age. So certain diseases are more common in certain age groups. For example, if you take into consideration rheumatoid arthritis, then it is more common in the age group of 30 years, that is young female. Apart from that, there are certain diseases like Hodgkin's lymphoma which shows bimodal peak, which means there are two peaks at two different age groups. Then comes sex of the patient. So sex is important for two main type of diseases. First is hormonal diseases, next is autoimmune diseases. So taking an example, in females, thyroid diseases, hypothyroidism, goiter, thyroid cancers, etc. are more common. Also, cervical cancer is a major problem. However, in males, certain diseases associated with tobacco and habits like lung diseases, squamous cell carcinoma, oral carcinoma, these are more common in males. Next comes the address. Residential address of the patient is important. Firstly, in patient tracking, which helps during mass vaccination protocols and all. Apart from that, it also helps us to know if the patient suffers from an endemic disease. For example, filariasis or elephantiasis, which we call it. It is an endemic disease. Coming to dental diseases again, fluorosis is an endemic disease. Malaria is also endemic in some cities and some towns of India. Then comes date of admission. Next is marital status. Marital status helps us to rule out any pregnancy, oral contraceptive pill, or history of any STD. Next comes socioeconomic status. The scale which is used to determine the socioeconomic status is modified Kuppuswamy scale. So why socioeconomic status is important? Certain diseases are more common in certain socioeconomic groups. For example, for people with high socioeconomic status, that is for rich people, lifestyle diseases such as diabetes and hypertension, these are more common. On the other hand, for people belonging to the lower socioeconomic status, diseases caused by deficiencies, nutritional deficiencies, or hookworm, pinworm and all such diseases, they are more common. Moving further, next comes the chief complaint of the patient. Chief complaint means वो क्या complaint लेके आपके पास आया है, उसको क्या ऐसी शिकायत है जिसकी वजह से उसे डॉक्टर को दिखाना पड़ रहा है. So chief complaint must be in patient's own language. This is very important. You cannot write the term pyrexia. Okay, you have to write, if the patient says he has fever, you have to write fever. If he says he has pain, then you have to write pain. You cannot use any specific medical term, like patient complains to you about pain in stomach. It is not pain in abdomen. Patient will not know the terms like abdomen. Okay, so you have to write it in the patient's language. Next comes the chronological order. Whatever the order the patient says he developed the symptoms in, you have to write it in that order. For example, if the patient had fever first followed by pain, then the chief complaint would be the patient complains of fever and pain from dash days, like for example 1 week or what. Next is the duration of each complaint. Moving further to the most important and detailed aspect of history taking, history of present illness, HOPI. So whenever you write the HOPI, you have to begin with the patient was apparently well dash dash days back. So if the patient had fever and pain from 5 days, then you have to write the patient was apparently well 5 days back when he first noticed. Then whatever complaints the patient has told you in the chief complaint, you have to describe the complaint one by one. So some of the complaints I have noted down here so that it is easier for you to ask the patient and to present a better HOPI in your exams. So one of the most common chief complaints includes pain. Pain may be in any region like thorax, abdomen, oral cavity, tooth pain, ear pain, neck pain, anything. So for pain history, there is a mnemonic which is Socrate. So S stands for site, जहाँ पे पेन है पेशेंट को. For example, the patient was apparently well 5 days back when he first noticed pain in abdomen or stomach, left stomach region, for example. Next comes the onset of the pain. The onset of the pain, it may be either sudden or it may be gradual. So sudden onset of pain indicates possibility of any trauma. Whenever the patient says that he had sudden pain, you have to always rule out the history of trauma. Again, it may be related to inflammation or acute diseases. Acute diseases. Now, moving on to the gradual onset. Gradual onset points towards the disease being chronic or malignant or infective. Next comes the character of the pain. The pain may be dull, continuous, sharp, piercing, lancinating, etc. Next comes the radiation. Based upon the radiation means pain कहाँ पे फैल रहा है. If it is spreading to other regions also, other than the originating point. For example, the pain may be radiating or non-radiating. Radiating pain may, for example, the pain of kidney stone or ureter stone or gallstone. Whenever there is a renal stone, then the pain tends to radiate towards the urethra, okay, and towards the abdomen as well. Coming to MI, the pain of MI usually radiates to the left shoulder region, to the left jaw region, and it may also radiate towards the back. Coming to association, A for association. You have to always ask if the pain is associated with any fever, swelling, or bleeding. Bleed may point out towards any trauma, rupture of vessel, or any injury. Swelling may point towards presence of any lump, malignancy, or a tender lymph node pointing towards infection. Other than that, fever, it points towards infection and inflammation. Next comes T for timing. मतलब how many times the patient experiences the pain, that is the frequency of the chief complaint, which is pain in this case. Next is exacerbation, which means किसी भी चीज से क्या उसका पेन बढ़ा है. For example, pain is increasing on application of heat or cold or posture. So certain diseases, for example, if we talk about cervical spondylitis, so the pain increases when you flex the neck. So in such cases, history of posture is also important. Next is the relieving factor, that if the patient has taken some drug and it has helped him relieve it, or certain things like खाना खाने से आराम पड़ता है, पानी पीने से आराम पड़ता है, like if the patient has acidity, sometimes उसको लेटने पे बढ़ती है, कभी कभी बैठने पे बढ़ती है, and such factors. Coming to the next chief complaint, which is vomiting. So vomiting, again, it can be sudden in onset or gradual in onset. Sudden in onset is seen most commonly with food poisoning. Food poisoning is one of the most important causes of sudden vomiting. Apart from that, it may be associated with acute pancreatitis, and consumption of alcohol. Next comes gradual. Gradual may again be associated with chronic diseases like presence of peptic ulcers, GERD, certain radio-induced medications, pregnancy and other things. Next is the duration, मतलब कितने दिन से उसको है, into days, months. Next is frequency, that how many times the patient vomits every day. Most important one in the history of vomiting is projectile or non-projectile. So projectile का मतलब ये नहीं होता कि projectile motion में उसको उल्टी हो रही है, arc बन रहा है, नहीं, it is not like that. Projectile vomiting means the vomiting which is preceded by nausea. Means if patient has a feeling that something is wrong with him, if he has nausea, headache or anything before the vomiting, then it is known as projectile vomiting. And if the symptoms and signs are absent before the episode of vomiting, then it is non-projectile vomiting. Next comes the contents of the vomiting. Presence of food particles is normal. Apart from that, there may be bile, that is green colored vomiting. Greenish clots or green colored vomiting, it is indicative of problem with hepatobiliary system. Next comes, if you see blood in vomiting, blood or blood clots or red colored vomiting, it is suggestive of upper GI bleed, means bleed in the stomach and esophagus. So upper GI bleed, it is responsible for blood in vomitus. Next is the volume or amount. You have to always give a rough idea about how much content is passed in each episode of vomiting. Next is its association with fever, pain, headache, etc. Next is again aggravation or relieving factors. Coming to the next chief complaint, which is stool related. When the patient has the chief complaint of diarrhea or constipation, what and all you have to ask? Again, the onset, which may be sudden in onset or gradual in onset. Duration की कितने दिन से है, frequency how many episodes per day. Then most importantly here is color. Some noticeable colors are, if the patient has pale clay colored or whitish stool, then it is suggestive of obstructive jaundice, or gallstones may be present in that case, or something that blocks the common bile duct. Next is a typical case, rice water diarrhea. It is seen in cholera. Next comes pea soup diarrhea, seen in typhoid. If there is increased amount of mucus present, then it may point towards inflammatory disease, for example IBS, celiac disease, etc. If there is black colored stool, then it is known as melena. So what happens in melena is that it is suggestive of GI bleed. There is black tarry stool, means upper GI bleed is passing down through the small intestine and through the anus and is secreted into the stool rather than moving out from the oral cavity. Then if there is presence of fresh frank bleed, means if there is red colored blood in the stool, then it is known as hematochezia. It is seen most commonly in lower GI causes, for example rectal pathologies and anal pathologies. If there is hemorrhoids, which is piles, if there is anal fissures, in that case you will see fresh bleed in the stools. If there is presence of blood clots and mucus, then it points towards anaerobic infection, and in this case the drug of choice is mostly metronidazole. So hematochezia and melena we have discussed. Associated with tenesmus. Tenesmus means excessive contraction of the Lower part of the abdomen during defecation means whenever the patient is passing stool, there is excessive abdominal pain and a feeling of contraction associated with tenesmus, bleeding, fever. Fever is again important in cases of typhoid. Then presence of any aggravation or relieving factors. For example, if there is aggravation by dairy products, then it points out towards lactose intolerance. Okay, so that is again an important factor. Coming to swelling, we will learn about this in detail when we study history taking in general surgery. So swelling may also you have to note about the onset. Onset may be sudden or gradual. Then there is duration of the swelling. Then there is initial size, and then how much the swelling changes. For example, when the patient noticed it first, it was pea-sized and gradually increased to the present size, whatever it is. Then you have to note about the growth, if the size has increased or decreased, consistency according to what the patient feels. Other than that, another common symptom may be neck rigidity. So in that case, you have to suspect meningitis also. Next common symptom would be breathlessness. Breathlessness may there is, you have to note onset, duration, association, aggravation and relieving factors. Moving further, past medical history of patient. So why the past medical history of the patient is important? So to rule out any disease that he previously had जिसका relapse हो गया होगा. For example, if the patient has certain disease, for example say TB, and he did not complete the treatment, so TB का relapse होता है, cancer का relapse होता है, and many such diseases. So for that you have to know the past medical history of the patient. So what all things we note in the past medical history? First of all, we note the presence of any diseases, past diseases or diseases that the patient has completed the treatment recently for. We have to note the disease along with duration, any medication taken by the patient on regular basis or any treatment which he has completed recently. This is important to avoid pharmacological reactions or cross-sensitivity reactions, like certain group of drugs alter the behavior of other drugs. There are drug inducers and drug inhibitors, if you know. So for that cases, we need to know what all medication the patient is on. Next is history of any surgery. Asking the patient history of any surgery, we tend to know that if the past surgical experience of the patient was good enough, if there was any problem during the anesthesia, intubation, or if blood transfusion was done during the surgery, so it helps us to evaluate risk during the next surgical process as well. Next is recent vaccinations and blood transfusion. History of blood transfusion is very important to rule out triple H, which is of great risk to the surgeon and the surgical team as well. Next is the patient's personal history. So personal history includes dietary history. For example, if the patient is vegetarian or not, or allergic to certain products. So why this is important? Certain diseases are more common in vegetarian and certain in non-vegetarian. For example, if the patient is vegetarian, B12 deficiency, it's very common. For non-vegetarian, tinea infections, that is hookworm, is more common. So you have to always note the dietary history of the patient. Other than that, you can also note about alcohol habits, tobacco habits, and sleep cycle of the patient. So the sleep cycle is important in case of psychiatric disorders, and also it may be important in case of liver diseases as well. So as we know, there is a thing called hepatic encephalopathy, in which the sleep pattern and the delirium of the patient, the senses of the patient is altered. Next is the bowel bladder habit, if the patient has been able to pass urine and stool properly or not. Coming to the general physical examination, whenever you do the general physical examination, the first thing is that you have to note about how well the patient is oriented. So you always begin with, on examination, the patient is found conscious, alert, well oriented to time, place and person. Next you have to mention about whether the patient's posture and everything is right or not. So consciousness is the key, well oriented, patient position means on examination the patient is lying supine on the bed in a well lit room. You have to always carry out the general physical examination in a well lit room so that things like pallor and icterus can be noticed very well. So to begin with, how we will write this? The patient on examination, the patient is conscious, well oriented to time, place and person and lying down in the supine position in a well lit room. Then you will note the temperature. If you have thermometer, then very well, or else you will simply write febrile or afebrile. Febrile means the patient has fever and afebrile means does not have fever. Next is BP. Next you have to go for the respiratory rate. Next you have to go for the pulse rate. Then comes the Brahmastra of general medicine, which is pickle. So P stands for pallor. Pallor means paleness of the skin or mucous membrane. Most common site is the lower palpebral conjunctiva. Presence of pallor points towards reduced RBC, that is anemia, reduced hemoglobin. Next comes icterus. So icterus is basically a synonym for jaundice in layman's language. So icterus is yellowish discoloration. It is noted on the bulbar conjunctiva. You retract the, if this is the patient's eye, you retract the upper eyelid upwards and ask the patient to look downwards. So this white portion you see over here, you see the icterus in this area. This is known as bulbar conjunctiva. So why this area, why there is changes noticed first in this area? Because this area has high elastin and elastin shows high affinity towards bilirubin. So whenever there is bilirubin deposit, it tends to occur first in the bulbar conjunctiva. Next comes cyanosis. Cyanosis is bluish discoloration due to presence of reduced hemoglobin. So most commonly we see hypoxia is the most common cause of cyanosis. Cyanosis may be central or peripheral. You can see it at various sites including tip of nose, inner corners of the lips. Apart from that, it may be seen at the fingertips and other regions. It is also divided into central cyanosis and peripheral cyanosis. Next is clubbing. So clubbing is a sign which is seen on the fingernails. Whenever you touch your fingernails of the first two fingers, you see a diamond. This is known as the scammer's diamond. If this diamond is absent, then there is presence of clubbing. So clubbing may be indicative of various diseases. It is commonly seen in carcinoma lung. It is commonly seen in bronchiectasis. Apart from that, it is also seen in certain GI conditions, ulcerative colitis, etc. Next comes lymphadenopathy, which means enlargement of local lymph nodes due to presence of any infection. Then lastly, it is edema. So edema is seen in the pretibial region where almost 1.5 centimeter above the medial malleolus, pressure is applied for 15 seconds and then the pressure is removed. So if there is pit present during this, then it is known as pitting edema. If there is no pit present, then non-pitting edema. Next comes the systemic examination. It is different for different systems, but here we will just discuss the general overview, what and all you have to write. So systemic examination has 4 steps: inspection, palpation, percussion and auscultation. So inspection. In inspection, you have to write what you see. You do not touch the patient. You just look at the patient, expose the area to be examined, look at it and write the findings. Do not touch the patient while writing inspection. So inspection may, for example, let us assume we are taking the history of a case of abdomen. Like for example, let us say we are taking a case of ascites. So you expose the patient's stomach and you look for, first thing is the symmetry, if the abdomen is symmetric or not. Next comes the color. You have to not describe the general color, but you have to look for abnormalities, like if there is an red patch is present, or in case of abdomen, if there are presence of spider nevi and all, there may be a patch present or something like that. So any abnormality you have to note that. Next comes the skin. So the skin overlying, you have to note for any scar, spot or presence of any vein, etc. Next comes the if there is a swelling, then you have to note its size. Next is palpation. Now you have to palpate the patient quadrant by quadrant firmly and after asking proper consent, obviously. So moving to palpation. Palpation may you have to note the temperature, that is the part is febrile to touch or not. Then you have to note the texture and consistency. Consistency may be soft and fluctuant or it may be firm. Firm ka example, if you look at the tip of your nose, then it is firm. Then there is hard. Hard is stony hard. Hard consistency is mostly indicative of malignancy. Then there are, if you have to note if the swelling is reducible or not. For example, if there is any swelling related to blood vessel, like angioma and all, you can easily reduce it. If you apply pressure, the swelling is completely reducible. Then you have to look for tenderness, means whenever you palpate the part, if the patient has pain or not. So tenderness is not asked to the patient. You have to look into the eyes of the patient. You have to judge by their expression if the part is tender or not. Because the patient always tends to lie. Do not trust the patient completely. Trust your examination more. Next is percussion. Percussion may you tap the part with the finger. So there is resonance. The on percussion means on tapping, you can hear three types of sound. One is dull sound. Next is resonant. Resonant sound is the normal sound. It is seen in places where air is filled. Then there is a tympanic note. Tympanic note is seen when there is a hollow viscous. Then there is a dull note. Dull note is seen if fluid and all is present. Then in case of abdominal examination, there are two things: fluid thrill and shifting dullness. So what is fluid thrill is that we will actually make a separate video on this because this video is already too long. Comment down below if you want a separate video on fluid thrill and shifting dullness. Then lastly comes the auscultation. Auscultation is performed by the stethoscope, wherein you hear the sounds of the viscous. For example, you can hear bowel sounds, you can hear heart sounds, breath sounds, etc., etc. Then most importantly comes the provisional diagnosis. Based upon the chief complaint and everything that you ruled out, you have to arrive at the provisional diagnosis. Then comes the differential कि इस chief complaint पे इसके अलावा क्या क्या diagnosis बन सकती है. Now, as I said you one thing, that chief complaint must be written in the chronological order. So why chronological order is important? So for example, if the patient complains of swelling, generalized swelling in the body, ठीक है? So the patient is talking about anasarca. Okay, so there is generalized swelling in the body. Now, if the swelling, it appeared first in the eye region, that is periorbital region, it points towards kidney disease. If the swelling appears first in the abdominal region, it is most likely to be associated with liver disease. And if the swelling occurred first at the feet region, then it is assumed to be of cardiac origin. So yeah, just by talking to the patient and listening to the symptoms and signs, you can actually diagnose a disease much before the lab reports come in. So talking to the patient and knowing what to ask is really important. So I hope you like this short insight on history taking, and I hope you become better clinicians in future. You have understood history taking. For any doubts, the comment section always welcomes your presence. Thank you. Hope to see you very soon once again.